Good morning, everyone. Welcome to Grand Rounds. We have a special Grand Rounds for you today. It's exciting. It's summer. We have new interns, and we have a great collaborative group speaking with us today. So our guest speakers are Dr. Justin Schreiber and Catherine Hunanan. Justin is a faculty member in psychiatry and pediatrics, and Catherine is the senior manager of special initiatives at the Pittsburgh Park Conservancy. They will be providing an in-depth look at one of UPMC Children's Community Health Programs, Parks Prescriptions, which is a partnership between Children's Community Health and the Pittsburgh Parks Conservancy. Children's Community Health Team supports the implementation of this program in clinical and community settings, utilizing the partnerships they've created with local schools, out-of-school time, early child care, and family support providers. And we're excited to hear about this innovative partnership and hopefully call to action to all of us. Dr. Schreiber received his bachelor's degree in science from the University of California, Los Angeles, and went on to receive his master's in public health, focused on health policy and administration at Boston University. He received his Doctor of Osteopathic Medicine at Touro University, Nevada College of Osteopathic Medicine, and did his residency and fellowship in pediatrics, general psychiatry, and child and adolescent psychiatry at the University of Pittsburgh here with us. During his time, he focused on projects addressing childhood obesity, collaborative care with pediatricians and child psychiatrists, and addressing the psychiatric needs of children with chronic medical conditions. Currently, Dr. Schreiber is an assistant professor of psychiatry and pediatrics at Western Psychiatric Hospital and UPMC Children's Hospital of Pittsburgh. He works with the General Academic Pediatrics Group and is the medical director for outpatient behavioral health services at Children's. He is also the medical director for the Whole Child Wellness Clinic and the associate program director for our triple board program. He serves as a course director for the pediatric resident mental health elective and psychiatry resident community psychiatric and child advocacy courses. Catherine Hunanan is the senior manager of special initiatives at the Pittsburgh Park Conservancy. With over 15 years of park professional educator experience, Catherine is driven by her passion for the outdoors, her belief in powerful impact of connecting nature and daily life, and her desire to make Pittsburgh parks accessible to all. As a senior manager of special initiatives, she works closely with community partners to plan and implement park improvement projects. She also leads the park prescription program that we're going to hear about today. She has trained hundreds of doctors, teachers, and early educational professionals in the best practices on counseling families on the health benefits of outdoor activity. She currently serves as chair of the Pennsylvania Recreation and Park Society Health, holds a Bachelor's of Arts in Human Ecology and Master's of Science in Parks and Resource Management and Environmental Education, and she has earned certificates in Public Health Fundamentals for park professionals and Foundations of Accessibility. Please join me in welcoming Dr. Schreiber and Catherine Hunanan today. Thank you.
Good morning, everyone. Thanks so much for having us out. We're really excited for the opportunity to talk about this. And as someone who's been having the opportunity to work on this for many years since being a resident, it's exciting to see it reaching this point right now. So first of all, no disclosures for the two of us. We're going to talk a little bit more about the evidence first that says, why should we be talking about parks? Why should we be talking about prescriptions? Why should we be talking about play? What the American Academy of Pediatrics recommends. And then a partnership that we have here at the Children's Hospital, working with the Parks Conservancy to get kids out to play, to get them out to parks. And then the partnership that we are starting with Park Checks America, and hopefully the next steps that we hope many of you will be able to participate in getting the kids that you work with out to parks. And one of the exciting parts about doing this at Grand Rounds is also recognizing that what we're going to be talking about today is important for those of us who are generalists and working in general pediatrics, but it's also extremely important for those of us who are specialists, for those of us who are outpatient, and for those of us who are inpatient. So recommending that these are things that we're going to talk about that are really relevant for all children that we work with. So give you a little case about a 20-year-old resident who's from California, new to Pittsburgh, working in the primary care center, and had this interest in looking at healthy habits. You might have guessed that was me. And I had this opportunity to meet with a 13-year-old who was physically active. He wasn't that physically active, mostly kind of when we talked about what was activity. It was about a couple of minute walk to school and back, but was interested in getting more involved, interested in finding other ways to be active, but really wanted the opportunity to play tennis and just didn't really know what that was. And I thought that was great as someone who played tennis, wanted to talk all about that, but I realized I had no idea where the parks were around me, where the parks were around her, and what we could do about kind of getting her out there to start doing this. So it brought to the question of what are the parks that are important for us to be able to get to? How do we know about them? Are we trained in that? Because that wasn't something I learned in orientation. So I guess first thing I'd want to ask to kind of pull the audience, and for those who are online, what are some of the parks that are near you? And people just feel free to throw them out or type online, what are some of the parks that you know that are close to you? What was that? Allegheny Cemetery, wonderful green space, yeah. I heard Franklin, Shenley, great. Arsenal, wonderful. What was that? Great, okay. How about, do you know some of the parks that are near the patients that you work with? Like when you're in clinic? A little bit less, yeah. So one of the things I found too, it was difficult to always know what were those parks that are around us. So we're going to talk a little bit more first about why should we have this conversation? Why should we try to incorporate that into the visits that we're doing? So there is some evidence that points to the benefit of outdoors, outdoor play, being in nature. I don't think that's surprising for all of us. I think all of us have an understanding that it's important. What I want to show is the level of importance, the level of impact. And my argument is that doing some of this work, encouraging it, making it part of our visits, can have significant health benefits for the kids that we're working with. And so though it can be difficult to sometimes fit it in, the evidence really points to the fact that there is good support for helping the kids that we're working with and getting them outside. So we've seen that not only is it important, and this is, I think, also especially exciting for me as a pediatrician and child psychiatrist, that this is something that's affecting the whole child. It's affecting development. We can see that the more that kids are out, the more the kids are playing, the better we see in terms of motor strength, balance, coordination, their emotional and social and educational development. We also see that its impact on sadness, on inattention and executive function, on just overall energy level improves significantly, and can also have impacts on areas such as vitamin D levels, blood sugar levels. And one of the things that I'll emphasize that I don't really talk about here is specifically focusing on weight management or obesity. And the reason why I do that is because I think sometimes the conversations about physical activity, going out into nature, being outside, playing, kind of gets pigeonholed into this idea that that's just for having conversations about specifically weight management or about obesity. And that really is not true. This is to show that this is an important topic across the barrier, across for all children that we talk with. Because of the multiple areas of evidence that we see in terms of this benefit. And I would really argue that what we see is that when we're talking about some of the areas that are impacting kids most right now, as we see the mental health pandemic that's affected the children we're working with, as we're seeing increases in depression, kids who are struggling more with executive function as they're taking on more tasks, that having that opportunity to get them outside is where we're going to see improvement. Also, that's a great way for us when we have conversations about parental bonding, is we want to say, what are things that we can do together? You know, instead of being on separate screens, what's something that we can do together as a family, and seeing that conversation of what are the things we can do together as a family at a park, or together outside when we're in nature, or when we're playing. And that can impact so many different kinds of kids, you know, especially those who we see have elevated areas of stress, elevated areas of trauma. And, you know, I know many of us work with those kids every day who could benefit from this. So I think as many conversations happen, the conversation is also about the negative aspect of screens. And I will say that as we've seen this decrease in outdoor play, we've seen this increase in screen use. And when we've looked at surveys, they've showed that when you look at our grandparents and then you look at parents, there's a continued drop in outdoor play. And at the same time, we see the amount of screen time increases. The difficult part is, of course, I think we lean towards just one aspect of this. We do know that social media specifically uses tools to be able to keep kids on, keep them on longer. And also at the same time, For any of you who have kids, my son just finished first grade. He has a computer he brings home with him. He does his homework on the computer. And so screens are becoming more and more integrated into the things that kids are doing constantly. So that's also making a part of, like, this is not thought of as just, oh, the entertainment, an extra part of something that I'm doing. It's part of my work. It's part of the things I have to do day to day. It's part of my communication with other people. And also we recognize that parents sometimes have fears about kids going out. Also, they don't know those areas. They don't know the parks. They don't know the nature areas. They don't know where kids are going or who they're going with. Maybe other kids aren't as active and out and social. So it's not that social connection that they had before. So when thinking about this problem, we have to make sure we're also thinking about there's more than just take the phone away, just take the computer away, just turn off the TV. We have to also work with families to understand what are the reasons that lead to that increase in screen utilization. There's also the concern around academic requirements. So one of the really big parts, and as we talk about the AAP's recommendations and the work that's being done here with the Parks Prescription Program, is it's not just a focus on what we do in the clinic, because that's really important, of course. At the same time, it's that partnership with the schools we work with and recognizing that as we've seen an increase in academic achievement requests, and so pushing this down to preschool, kindergarten ages of requiring more academic needs, that has sometimes led to saying, where do we fit that time? Let's take that out of recess. Let's take that out of outdoor play. Remove a little bit more of that generally what would be considered a very typical thing for kids to do. And with that, we're seeing these significant drops with preschool age kids who are just not going out to walk or play. We're seeing it for kindergartners, that that's not necessarily an assumed thing, that every child is going to have recess as part of kindergarten. And so the assumption is, of course, what that means, we're getting more opportunities to talk about math and English. And so they're going to be ready and better and able to have more academic achievement. What we've actually seen is the opposites happen. There was a study in England where they actually had kids who would come to school and they would do something outside for 20 to 30 minutes and then come in, versus another group that came right in and started doing academic work. The difference was significant in terms of the amount of academic achievement that was improved and showed with overall improvement, executive function, attention for those kids that actually had the activity opportunities. So this is really producing more of the opposite results. And that's why it's so important with the knowledge that we're gaining, the knowledge that we see of what's really beneficial for kids' physical health, mental health, and academic health and achievement, that moving towards this idea of actually the outdoor play, the inclusion of recess is so important. A lot of this evidence led to the point of saying from the American Academy of Pediatrics that we need to really make the discussion of play, the discussion of going outdoors, a part of our clinic visit. We need to work in multiple areas around advocacy, saying that within the guideline that we should be really pushing, talking to schools, encouraging at the youngest levels, preschool, kindergarten, that there is playtime encouraged. And that we should emphasize this so much that it should be a part of our visit, that we should even write a prescription, because a lot of us now put a prescription online, but still there's a thought of what a prescription means. When I write something down, when I give it to you, it's something saying this is important. I would love to see you follow up on this because I think for your health, this is what's going to be most helpful. And I want to emphasize that. It also triggers for us. If we're going to write a prescription, it means we have to think about it. It has to be part of our visit. It's, not just something that's including all the list of things, but something that's so important. We're giving them a handout to say, you're going to go do this, and here's the parks or the places you're going to go to do that at. And so this is that encouragement to say that for all of us, that should be the next step as we're thinking about adding the prescriptions. So the idea of taking that, not just a prescription, but a prescription to a park has existed before. This is something that's been done in other countries. It's been something that more recently got a lot of attention with Dr. Czar, who is a pediatrician in DC, who found that similar to what many we've seen, to my case story, to the case story I'm sure many of you have experienced before, of we know there's these great spaces that are free for families, and we would love to get them actively involved and participating. And at the same time, we don't always know where they are. We don't know how to give them that information appropriately. We don't know how to fit that into the visit that we're doing. So came up with the idea of, could we create something that is a park prescription for DC that really focuses on access? How do you get to the parks? How do you park at the parks? How do you take the bus to the parks? Safety of the parks, lighting of the parks, the times that they're open, and what are the facilities? So we want to really encourage that those who are going to be going to the parks know what's available, what are the things that they can see when they're there. And how do we fit that in? How do we make it as easy as possible so it fits into the busy schedule? Because we know that, again, there's a lot to talk about in 15 minutes, 20 minutes, 30 minutes. Even if we have a longer time visit, such as, for psychiatry, there's still a lot we're going to be discussing in that visit. And so making sure we can incorporate that into it and it doesn't feel like it's making something else get lost. And this led to the development of the DC Parks prescription and now the growth to Parks Recs America. And we'll talk a bit more about that connection to what we'll be doing here at Children's as well. So in terms of, again, like I said, this is not the first time the parks prescription has been discussed. The evidence really said that when we look at this in other countries, that it does get people out. It gets adults out, it gets kids out, gets them to be more physically active. We see it improves their mental well-being. So the idea of that conversation happening in the clinic visit leads to more and more people going out and doing things like this. And we also see that there's a lot of information we still need to figure out. We need to know, a lot of times we can write that prescription, but what's the follow-up? Did it work? Was there barriers? How do people, is there a reason that someone was not able to access to fill that? And so we also are seeing that we need to get more information to better understand how to do this most appropriately, working best with families, understanding the needs that will help to get them out. So at this point, the resident knows it's important. We need to be getting people out to play, getting people out to parks. But the question is, again, where are the parks here in Pittsburgh? What's at the park? So we're going to recommend someone to go. We don't want to say you really want to go because you want a place where you can play tennis and we send them there and there's no tennis courts, or a place where they want to walk and there's no pathways there. So we want to understand that a little better. And then how do we talk about that? How do we talk to families about it? How do we encourage that? How do we provide appropriate resources and work collaboratively to families to get them out? Just to put everyone on the spot, anyone ever done this before? Like, even if it wasn't official writing it down or using the ones we've had before, anyone done a prescription to parks or encourage that conversation going on to parks? Well, there's a great opportunity for a lot of growing and building on it. Well, with that, I will pass it over to Catherine to talk a little bit more about the parks.
Hi, everyone. Good morning. Is my volume okay? Okay, great. Well, again, I'm Catherine with the Pittsburgh Parks Conservancy. How many of you are familiar or have heard of that organization before? A few of you. Okay, great. We are a nonprofit partner to the city of Pittsburgh to improve our parks and green spaces, to improve the quality of life for all Pittsburghers. The Pittsburgh park system is quite large. There are about, I say about because the number is constantly changing. New parks come online, some get closed. There are about 176 parks. This includes our large regional parks. Some of you mentioned them before. They're all each over 200 acres in size. The largest regional park is Frick Park, which is, there's no laser. Well, it's in the far eastern side of the city, and it's over 600 acres. And then all of the other ones in dark green there are other regional parks: Emerald View, Highland, Riverview, and Shenley. Kind of spread out geographically, which is nice for access to those larger park areas. And then sprinkled throughout the city, we have some community-sized parks that are all over 60 acres. There are about 9 of those. And then you have your parklets, recreation centers, healthy active living centers for seniors. So a lot of resources that are available throughout the city. This is just a overview, a short list of the kinds of amenities and resources that are available. There's a lot of information on our website as well as the City Parks website, which I've linked here. that give information about where to find these spaces. On the Pittsburgh Parks RX website, we have developed a map that is searchable by the amenities that are most important to people. What do you think might be an amenity in a park that would be like the #1 concern for park visitors? Bathrooms, you got it. Unfortunately, a lot of our parks, all they have is a porta-john, but at least they have a porta-john seasonally. A lot of when we're working on capital improvement projects with the city of Pittsburgh, bathrooms is like one of the #1 things that is always mentioned as a top priority for community members. And so more and more of those facilities are being incorporated into parks when there are big park renovation projects. In addition, I want to highlight how important our parks are for people to find respite, connect with nature. Our regional and community parks are really important spaces where you can find trail access. And a lot of people that are not familiar with the trail systems in the city, they will not venture out on their own because they're scared of getting lost, or they're concerned about safety, or they just simply don't know where to go, where to park. And so part of what we're doing with, through the Parks Conservancy and the Park Prescription Program is to provide resources that really help people to get familiar with those spaces so that they can also access the benefits of being able to go out in nature. Has anybody ever been on that trail in Shenley where you have that beautiful bridge and you walk down to the lake? For busy, stressed out people like you, if you're ever stressed, that's a wonderful place to go, and it's right here in Oakland. Part of what we're doing is providing programming like forest bathing walks, naturalist-led hikes, so that people can get to know those spaces in a group setting, get familiarized with them, and then hopefully, go back on their own. So the Parks Prescription Program, in partnership with the hospital, started back in 2015, initiated by Dr. Schreiber wanting to get to know more about the park system, and then beginning these conversations with the hospital community health team, and forming a strategic partnership through which we looked at the priorities identified in the community health needs assessment, and this seemed like a perfect collaboration to help support addressing those needs. In the introduction, you heard a little bit about community health's role. This graphic just shows all of the spaces kind of inside and outside of the hospital that the community health team partners with. And the team really serves as a bridge between the clinical setting and community partners and patients within the community setting. And the Parks Conservancy being one of a myriad of community partners that are connected to all of these spaces as well as the clinical space to collaborate on community health initiatives. So because there was this opportunity to work with community health and all of these different touch points that they have, we were able to develop a park prescription model that is not just clinically based. A lot of the models across that exist in the United States are clinically based, where it's a physician or a healthcare provider providing that prescription to an individual. Through the community health lens, we've been able to develop these pathways in schools, in the community setting, and in the clinical setting. So through the Children's Hospital Healthy Schools program, we provide training and technical assistance, resources. Some grants have allowed us to do direct programming with some of those schools to demonstrate to teachers and nurses, counselors, how they can be encouraging outdoor play and incorporating more outdoor time into their setting, as well as encouraging families to get out. Similarly, in the community setting, we do trainings and offer services to after-school providers, family support centers, so like the Family Care Connection centers that are affiliated with the hospital, as well as other family support centers throughout the county. And then working with neighborhood-based groups as well. And then, of course, today we're going to go into a little more detail about the clinical implementation. As far as where we're partnering and how we're partnering, we are taking into account a focus on wanting to address disparities. In 2018 and 19, the Parks Conservancy did a study to develop a equitable park investment strategy. And this was investment both in the physical park infrastructure as well as in programming and in building partnerships across the city. And this is just a little bit of data that came from that study and report. So these are the averages on the Pittsburgh level, and then where the dots you see on the map are 18 priority parks that are in communities where you can see that there's, in some cases, a very stark disparity in some of these indicators. So overall, for the Parks Prescription Program, this is our goal, and we look towards improving health and well-being through increasing knowledge of the parks, increasing kind of that motivation and desire to utilize the parks. And through that, hopefully folks will get out, they will get more active, as well as more exposure to fresh air, to trees, to the natural world, which, as Dr. Schreiber was saying, has all of those associated benefits. So in 2017, we assembled an advisory committee. It included the county health department, the community health group, a few different primary care providers in different settings, and developed a mechanism to issue prescriptions in the clinical setting. So over the course of 2018-19, and actually through the end of the 19, we were supposed to meet in March of 2020 to go over the results of the pilot. That didn't occur, and a lot has happened since. But over the course of about 2 years, 100 providers participated in trainings. We had 8 different sites and tracked about 1,500 prescriptions. There was an effort to incorporate a patient letter into the EMR. Some clinics gave that a try, but ultimately most were using paper prescription materials. And as a result of that, what we were really learning, which is probably not surprising, is that there's not an easy mechanism to get feedback back from the patient. Are you actually doing what I'm recommending? How do we track this? How do we know what the results are? And so starting in 2020 and then in 2021, kind of launched this opportunity to have a digital prescription tool through the ParkRx America platform. Before we talk about that, I'll just briefly touch on the other materials that were created to support this reinforcement outside the clinic and addressing some of the barriers that Dr. Schreiber mentioned, such as patients that may not know where to go. They may want some guidance on safety. They might have a transportation barrier. So we developed seasonal tip sheets based on what we were hearing from providers that might be important information to include. We included information such as where are the summer food programs that City Parks provides, where they had a food truck going for a while that would show up at certain parks and spray parks throughout the summer. And so that sort of information was included. On the winter tip sheet, we had information like, if you don't have winter gear, where can you get it? How do you layer using just normal clothes in order to be warm to get outside in the wintertime? So those sorts of, that sort of information. And then also outdoor program opportunities, which can be so important if people are not familiar with a space and want to try something new, but they don't really know how, or they have safety concerns and want to maybe tap into a recreation center where there's staff available in the park to facilitate those programming opportunities. And then we also have some of these materials translated into Spanish. I think there's a lot of room for growth there in terms of translation, and I'm sure there are other languages that are really important as well. We did have one piece translated into Arabic as well. Now I'm going to pass it back to you.
So I want to emphasize one piece of this too, is the importance of partnership. And I think all of us know that when we come into residency as we're residents, that the understanding of being able to know about every single park in a city or where kids are coming from is oftentimes well beyond the amount of things we already have to learn. And so the opportunity to work with the Parks Conservancy has been amazing, and really appreciate all that Catherine has done to really build this up. And also for our community health group too, to be able to really focus. And I make sure for Chrissy who's here to recognize a lot of the work that's put in, and Enrique Chair about really developing this beyond just in the clinical piece. Because like I mentioned, this is impossible to see the benefit without really having multiple connections, such as with our schools. And so there's a lot of work that's happening behind the scenes. And this, if anything, I think we're great to see how many of our trainees are here, reinforcing that when we're working on something, the involvement of partnership is so important. There are so many community leaders who are doing this work. And also within our home children's hospital, people who have specialties to really focus and help us build this. I just want to go back to one thing, because there's one thing about the seasonal tip sheets that I think is so important. How many of you have had a visit and it's November till about in Pittsburgh, April, and you've gotten pushback of I can't go outside. It's too cold. There's, we got to stay inside because this is what we do for the winter. Any thoughts of what people might do when they hear that, when they hear it's too cold, I can't go out? Cross country skiing, okay, yeah, good. Yeah. Other thoughts? Good, yeah, okay. So how do we access, like I was mentioned, wearing warmer clothes, great. Exactly, yeah. So other things we can also do that can be active and play and build that even outside the home. And, even simply going outside, it doesn't mean because it's snowed out that we can't do things that are still snow-based activities or wind-based activities or sledding or snowball fights or kind of all of these things. And I think reinforcing and kind of converting that message that the wintertime doesn't have to be a time we're inside all the time. We can still be outside, we can still be doing things. And how do we support our families? And so this is one of those things why the tip sheets can be so helpful. And we want to make sure people continue to have access to that.
I could also just mention there's an interesting study that came out in 2019 that was, what is the dose, the minimum dose of outside of nature that's going to be beneficial for a person? And that study found that in as little as 20 minutes outside, you're getting the benefits for your brain, for those stress levels, for your heart. And so, in terms of wintertime, it could just be, okay, well, you can't make the trek to a whole park or, how about just your backyard? Let's just keep emphasizing that even a little bit of time outside can bring about the benefits, both the physical and the mental benefits. So just some food for thought.
I think that one of the things that really we gained from this was understanding about the possibility that we can do this. When we looked at it, and this was a very kind of basic study of what we got out of being able to do these parks prescriptions, was with all these sites that we had. I was expecting not many prescriptions hand out. We were able to get about 1,200 out. We were getting constant from multiple different sites. We were, again, various sites throughout the city, people requesting more to be sent over for them. At the primary care center, we actually incorporated, we have many here who work at the primary care center. Have any of you seen the posters that are up on the doors? See some head nods, yep. So we've put those up as a trigger to be able to talk to people, to make sure that families see that, know that this is a conversation starter. And then we also had our MAs put the prescriptions in with the materials when they first came in. So it was a conversation started for the families when they looked at it, but also for us. So we saw that we were able to get a lot of these out there as we find new and innovative ways of incorporating our whole clinical staff into the Parks prescription. And what people responded by saying was that they felt like it could fit in really easily. It was part of the conversation they were already having. And so it didn't feel like it had to be, as they started to incorporate the prescription, it became just more and more a part of the typical visit that they were doing. And also that kind of similar to what we'd expect, that there were a lot of families that didn't realize the amount of parks that exist here. And that in an urban center, oftentimes we feel like there can't be green spaces, but the amount of green that exists here is amazing. Someone who, comes from Southern California, which is kind of greenish, but I was blown away with the amount of green that I saw here when I first came out and the amount of support that goes into really making those into great spaces where families can go to. So we surveyed people too to say, does this seem like it's something that they've learned more about parks? Do they incorporate parks more? And we did find that there was an increase in knowledge that this is probably where we have the most work to do. And this is where we're talking more about Parks Rex Americas, just this fact that we know that we need to build that knowledge base more. And we did some, but there's growth to go. But we did find that this really increased the amount of actual prescribing, talking about it, incorporating into the visit that happened, and also feeling like this is actually beneficial. I should incorporate this. I think it already was pretty clear, but to just jump up to say, yes, we really need to make sure this is a part of our visit, and this is important for the families we're working with. We did learn that this is a way to, again, reinforce it. We were making sure that it was a physical way of having that conversation, of incorporating it into it, making sure it's something that was added into the conversation that we do when we're doing a well check, when we're even having someone who's coming in for anything else, for an ADHD check, or for coming in because of a cold. There's ways to bring it into kind of various different ways various different conversations that are happening in different visits. And that we were hearing positive feedback. I know that was a constant thing I heard of people coming back and saying, I was able to check out this one park, and actually we went as a family. This was something we did. So getting that kind of feedback where people were connecting, they felt it was beneficial, was also really positive to hear. We still know there's more to do, and this is why we've moved on to these other steps of how do we make sure that it can fit into the clinic flow? How can we make sure that it doesn't overwhelm when there's a lot of things we have to talk about when that we know are going to happen daily? How do we make sure that we're also kind of incorporating it across different areas, different specialties, to recognize that if someone's, again, in the hospital, seeing a subspecialist could also be beneficial. And then the other part of it is, of course, we can ask people when they come back, but we don't really have great ways of tracking, like, are people going? Are they doing it? Is this helpful? Is it actually working? Is it worth our time? And so that's kind of these next steps too, of how do we increase that opportunity to be able to see, is this beneficial for people? And so we've moved from using the kind of one specifically that is for the handout, and one that was incorporated for some in the EMR, to more of a combination with the Parks Rex America for the digital prescription. So I'll pass over to Catherine to talk about.
Yeah. So Parks Rex America provides an online HIPAA compliant platform that doesn't store any kind of identifying patient information, but it does allow for some good functionality in terms of issuing a digital prescription that can also be printed in the office and handed to the patient, but the patient can receive it either via text message or email. They are currently working on an app. Everyone is asking for an app. I don't know exactly where that stands, but it has not been made available yet. It also provides the opportunity to set up reminders, so a patient can opt into receiving a text or email reminder about their prescription. And then in the portal, each individual account has the ability to track their prescriptions by a unique number, and that can be incorporated into the notes section in an EMR, for example, to track patient adherence. So we have, before I move on to the video from Parks Rex America, I wanted to emphasize that when they first started, they were very focused on a provider being able to prescribe a specific location, which can be very important. for some patients. But in some cases, a patient may say, you know what, a park's too far away. I'm really never going to get there. You can also, they've shifted their focus to, it has to be a park, to it can be in your neighborhood. It can be your backyard. It can be a walk around the block. Just outdoor time and connection to nature being equally as important as sort of the physically go out and play in a park setting. So instead of having to prescribe a specific place, the place section of the prescription allows you to just type in a custom location as well. Okay. 1 second.
And I'm the medical director for PRA. I'm going to show you step by step how to prescribe nature to your patients. First, open any browser and type in parkrxamerica.org and bookmark this page as a favorite so you'll know where to come the next time you want to prescribe. Tap on providers and press prescribe. Now log in, create an account if you don't already have one. If this is the first time you're writing a nature prescription for this patient, simply close this window. If this is not your first time for this patient, check their adherence to their previous script by going back to their EHR record where you documented their last one. Now, copy that unique RX code and paste it here. You can see how many times they filled their last nature script. Seeing how successful their previous nature prescription was will help you fine-tune their next one. Now it's time to prescribe. Ask your patient where they feel safe and comfortable outside and write that in. Ask them what they enjoy doing outside or what they can commit to doing outside, whether alone or with someone, and try to include as much detail as you can. The more specific, the more likely your patient knows to take this seriously. Ask them how many times per week they can commit to doing this activity. Even better, find out which days of the week, whether morning or afternoon, before work or after school. This is a perfect opportunity for you to think about therapeutic goals based on your patient's needs and capacity. Lastly, ask how many minutes or hours they can realistically commit to engaging in this activity. Then press submit, and you've written your nature prescription. Now it's time to set up a text or email notification to remind your patient to fill their nature prescription. Ask your patient for permission to share their cell or email with PRA. If they say yes, type in their number or email address and set the frequency and duration. Then press send reminder. Now it's time to copy and paste this nature prescription into your patient's EHR. Click copy, then leave this platform momentarily and go back to your EHR and paste the exact prescription you just wrote back into the treatment section of your note by using the Control-V keys on your keyboard. Remind your patient to check their text or email, where they'll find a link to give their consent and agree to the terms and conditions for them to receive reminders. Please remind them to log their visits every time they fill their script. Remind your patients that you'll be following how many times they fill their nature prescription. And you're done. I hope you found this video useful. If you have any questions, don't hesitate to send me a message. Thanks for listening.
Okay.
So I think we have a little bit of time, enough for me to demonstrate a little bit of how we can do this. So I am going to hopefully pull up Parks America site. And so I wanted to take a volunteer who lives in the city and is okay with getting a text message. All right. So this is an example where if you wanted to look up the park for them, of course, you can put into place anything specifically. If you want to just say, go outside in the backyard, the park that you know about that's near you, but let's say you don't know about it. Are you okay giving me your zip code? So you can see that these would be the close parks by within the next 0.2 miles, a mile. Oops, just kidding. That was the old one. So you can see which ones are closest, including Pitt Park. So then, if we click by that one, add a park, it's in there. What are some things you like to do when you're outside?
I like hiking.
Hiking, okay. How often do you think you could see yourself going hiking? Weekly, monthly? Okay. That's I think realistic goals is always important, so key. And then when you go for a hike, how long would you want to go for? Perfect. All right. Are you okay with getting a text message reminder? Wonderful. What is your number?
609 713 2220.
I'll block that out on the recording.
And since you're saying monthly, we'll send it once a month. And now you should start getting those. So, it took about a minute to be able to do, and opportunities for you to be able to see. And so I didn't copy it, but you can then copy it in there and it would pull it up where you'd be able to see from those text messages. There'd be a text message link that would say a reminder, and they're also filling out information of the person when. So then you can get that feedback, and it could be something that you bring up at the next visit. I saw that worked really well. You were able to go. You even went more often than we talked about. Or, the job must have gotten busy. It must have been during viral respiratory season. So I haven't seen, it's been a few months since we've last gone. So we want to reframe that goal a little bit. So knowing within the behavioral health world, the importance of us also thinking about really setting good guidelines, making sure we're setting something that's really a goal that is a smart goal, something that people feel is accomplishable, is really important for people to really follow through, and really not being judgmental in that. We're not there in the pediatrician's office to say you're going to do an hour of activity a day, which we know is a recommendation. We want to encourage that, but to say that realistic is really important. If we know that's not where we're going to be at, of someone who's been doing about 15 minutes, every 2 weeks, jumping to an hour a day is going to be pretty impossible. So we want to make sure we're setting something realistic for them, and that's how we can do this and check with it. So this leads to our next step, which is really a kind of call to action. As we've talked about, and we've already talked with the primary care center, and we're finding ways to really incorporate it into that setting, and having medical students who will take the lead. We have some great resident champions who are going to be helping us to really promote it and to get the word out there. And also encouraging all of our attendings there. We want to really open this up for all of you who are here, all of you who are online, to think about also bringing it to various divisions. We've got a great group of inpatient attendings too, thinking about in the inpatient world as well. All these opportunities are things we can talk about when someone comes in, to even promote this ability to be more active, go to the parks. And then also really finding champions within different divisions who are interested in promoting this, talking about it, kind of taking the lead, getting feedback, so we can make this as best of a resource for you all, and as best a resource for the families we work with. I also want to make a quick plug. We have a program called Walk with the Doc, which we recently had a bunch of trainees who joined us for, and a couple of different kids who came out as well. Christy's daughter and my son were there, and a couple other kids. And really this opportunity to interact with our families outside of the clinic, take them to different spaces, show them around parks, do fun things there, and also really get ourselves the opportunity to see it too. Because, like I said, we're busy too. It's nice for us to know and to make sure we're thinking of our own mental health and our own physical health by having that opportunity to go out as well. We're partnering with, on the adult side, with family medicine to really try to have one of these Walk with the Doc programs happening every single month. And so we'll continue to get the word out about that as well. So if you are interested in any way, you have our contact information. Please don't hesitate to reach out. We would love to grow this, love to interact more with you, and really appreciate so much the opportunity to be able to talk about this opportunity for the families that we work with. Thanks a lot.
I think there's the chat and the Q&A. Is that something we should be moderating from up here?
No, I'm gonna do that.
Okay, before we move on to that, I failed to mention, when I was talking about the history of, the park prescription partnership with the hospital, what a key role, Anne Marie Cachera, who's the director of community health, has been on board since the beginning. She's been a key person, in helping to develop the program. And Christy Burry, who is here, who's the manager of, health and prevention. Christy, do you want to wave in case folks don't know who you are? And I'm sure any questions about kind of that relationship and how all that works, Christy can help with answering those questions. Thank you.